Thank you, Dr. Ali, so much for being on the podcast today. I really appreciate it.
Well, I'm so happy and I'm glad that you invited me.
Absolutely. Let's just dive right into things. Why don't we start by taking a little bit of a step back, and could you share with our listeners a little bit more about what you do?
So basically, I have two different roles. The first role is that I'm a functional integrative physician. And the second is that I'm actually a mindfulness coach. And I think that both of these roles came into the picture after I got completely burnt out in conventional practice. So I'm actually board certified in internal medicine, and I'm board certified in integrative medicine. I'm also a diplomat of the ABIHM, American Board of Integrative Holistic Medicine, and a member of the Institute of Functional Medicine. But when I finished my internal medicine residency, I started as an academic hospitalist with Penn, University of Pennsylvania Health System. And I was not happy because basically what we were doing is that we were seeing the same patient repeatedly. It was hospitalization, rehospitalization, readmission. And it appeared that nobody was really interested in talking about, why is this happening? It was all about just get the job done. And the most important thing we had to do was to discharge the patient, who would then land in the ER within like 2 weeks.
Yeah.
And it was extremely frustrating because there was really, as a physician, I was just basically a body, a number, a cogwheel, right? So at that point in time, I realized this was not for me. And I thought maybe if I go into an outpatient setting, I might be able to reduce these readmissions that we're constantly seeing. And that put me into academic medicine again, where I was an associate program director for a community hospital in the internal medicine program. And honestly, I love to teach. And so I was very happy. And I loved my residents and they were awesome. And I think that the outpatient setting is definitely better from the educational standpoint. And initially I was enjoying it. But then, what happened was that the number of patients actually keep on going up. The list of medications keep on going up. And really every 10 minutes, you have a patient. And I remember this very vividly. I was in the room with a woman who actually was recently divorced. She was crying in the room. I was worried about her. She was very depressed. And I'm trying to figure out what is the probability that she's going to harm herself and how do I help her, because she was absolutely adamant that she's not going to take any medication. And while I'm having this discussion, I'm having knock after knock after knock on my door. Really, we have 2 patients waiting. Dr. Lee, we have 3 patients waiting. And I'm thinking to myself, what am I doing here? What am I supposed to do here? Am I supposed to tell her, listen, I have other patients, you just go home, take a pill, and you just have to do that, and I really can't spend any more time? And that, at that point in time, I started to think that, what is really my role here? Is this really what I want to do? Long story short, a point came where I was like done. I tried very hard to tell them, look, I have a degree in integrative medicine. I really can do this. But clearly, it was all about insurance and money and time. And so I basically resigned. And at the time when I resigned, I had no job. And I didn't even know what I'm going to do because I'd never been in an integrative medicine practice. I literally started from scratch. And I feel very blessed, honestly, because when I started, it was not about creating a practice. It was about, I just want to do this. I don't care. I want to do this and that's it. And I'm going to do it my way, because since I have not seen any other models, I really don't have an option at this point in time. And that's how I started my practice. And I feel so blessed because, today when I go to my office, I know I'm going to change somebody's life. I know I'm going to help them. And I'm actually going to have the time I need to sit and talk to the patient and be able to understand them and be able to help them understand the root cause of their disease. And that's what I was initially doing. And then I realized that, we talk a lot about changing the diet and we talk a lot about, changing lifestyle, but it's very difficult because
Mhm.
A lot of it has to do with how we were brought up. A lot of it has to do with deconditioning, and deconditioning is not very easy because most of the time we don't know why we are doing what we are doing, you know. And so that got me into what we call mindfulness coaching. And, to be honest with you, mind over matter is something you realize as a functional physician, because it doesn't matter how much knowledge you have or how much information you pass on to the patient, but things will never change until and unless that patient feels empowered and feels like they can do it. And that's when the coaching part came, and I realized that the two were incomplete without each other. And so that's where I am.
And you used a few terms that I just want to make sure listeners understand, because you used integrative medicine, you used functional medicine, and another term that comes up that I hear as well is precision medicine. So
Right.
Could you explain to listeners the differences, or maybe these all mean the same thing? Help us understand.
So they definitely don't mean the same thing. So integrative medicine is basically where you integrate different tools. So you could be writing a prescription, but at the same time, you'll say, well, I'll also give you a supplement because I think that for X thing, you don't necessarily need a medication, but a supplement might suffice. And we may not have to give you something very powerful, which will have a lot of side effects. So you are basically practicing integrative medicine, or you may tell the patient, your pain is there. And I think that in addition to this, why don't you go ahead and do some acupuncture? Because I think that we actually have research which shows that acupuncture can be extremely helpful for this type of chronic back pain, right? So you are an integrative physician because you're integrating. A functional medicine physician or a functional practitioner is a physician that actually is going to look at your low back pain, for example, if that's your concern, and will say, why do you have low back pain? So let's start by figuring out what's going on. Is it a structural problem? Is it an inflammation related problem? Is it a problem that is linked to your digestive tract? Because if you look at the place of the low back pain, and if you look into the Ayurvedic model of healing, it talks about the chakras. And the first chakra, which is the base chakra, is the chakra where there is the back and there is the gut. And a lot of people with digestive tract issues will have low back pain. So now you're saying, I don't think it's a back issue. It's something else that's going on. And so now you're a functional physician because what you did was you didn't just look at a symptom and started treating, okay, here, this is the problem, I'm going to treat it. You said, no. This is not going to work because we have to look at the why of the equation, and the why could be 1, the why could be 5. And so you go ahead and address the why of the equation. That is when you're practicing functional medicine. And then precision medicine or personalized medicine is a term which is often used in the space of functional medicine because functional medicine has a number of different characteristics. One of the characteristics of functional medicine is precision medicine. What precision medicine says is that every patient is unique. They are not only unique in their history, but they're unique in their genetics. They're unique in their exposures, their lifestyles, the environmental factors that they have been exposed to. And so let's suppose if a patient has high blood pressure. In conventional medicine, for treatment of high blood pressure, we have tiers, tier 1, tier 2, tier 3, tier 4. This is the blood pressure 1 medication. This is the blood pressure 2 medication. And it stays the same irrespective of the patient's genetics and all the other factors that I've talked about, right? But in a precision style of medicine, you will say that this patient and that patient, both of them have high blood pressure. They have the same degree of high blood pressure, but we're going to treat them differently. And the reason why we are treating them differently is because the root cause of their blood pressure is different. And that is personalized medicine, where even when we talk about diet, and this is particularly important about diet, because if you go to google.com, Dr. Google will have a lot of people, there's somebody will say, keto is the way to go. Somebody will tell you, somebody will say, vegan. No, vegan is the way to go. Now everybody is very confused because it looks like that there is a group of people who are benefiting from every particular diet that you look into. And so what does that mean? It means that, what we say is that, okay, one size fits all, but that's not the way it's going to work. So the diet has to be customized, to the patient rather than the patient customizes himself or herself to the diet, So I think that that is where this is one of the very important characteristics of functional medicine, is that it actually customizes, personalizes the approach to the patient. That's one aspect of functional medicine. But there are other aspects of functional medicine. For example, another aspect of functional medicine is comprehensive evaluation. So when you get into conventional medicine, you will get a basic panel of blood work, right? And if that is normal, you're good. Even if you're saying, but I'm fatigued, you'll be said, maybe you're depressed. So now you should go home. And the patient thinks, maybe I must be crazy because I've gone to 3 physicians and they all think that everything is normal. And the reason is because the assessment is so superficial. And actually, I would say the assessment is more structural. So for example, if you look at liver function tests that we do, they're not liver function tests, they're liver structural tests. Why? Because ALT and AST are present inside the liver cells. And the liver cells literally have to burst to get into the bloodstream for it to go up, for us to say the liver is now actually getting destroyed. So at that point in time, it's not the function of the liver that's just affected. Structurally, the liver cells are literally bursting open. So that, if you do endoscopy, colonoscopy, that's all structure. So conventional medicine, the approach is more focused on the structure and more so focused on disease model, right? You have to be able to diagnose. If you can't diagnose, we can't do anything, because we cannot generate a code. We cannot generate a code. We cannot bill the patient. We can't do anything. Okay. So in functional medicine, we actually have functional tests. The functional testing is very different because it actually looks into the root cause. For example, it will look at environmental toxins. It will look into leaky gut. You know, if you go to a gastroenterologist and you say, I have a leaky gut, he will look at you as if you have 5 heads. Yeah. And because he doesn't know what you're talking about. But the term that you want to use with a gastroenterologist is intestinal permeability. And then he'll be like, oh, this sounds scientific. Yeah, it's scientific. Why don't you go on PubMed? And you'll see lots of literature on that. So we have what we call a comprehensive evaluation, which actually assesses the root cause. And then very importantly, the third aspect of functional medicine is its reliance on lifestyle modification. You know, so you're not just kind of saying, okay, you have depression, here's the pill, go home, everything is going to be okay. You basically say, what is it that you are doing which is going to affect your mental health? Let's work on that. Let's work on what you eat, what you expose yourself to, so on and so forth. So before you start a prescription, you have to work on the lifestyle. And in addition to that, another important area of functional medicine is integrative therapy. So those therapies could be like we talked about. This is an area, integrative therapies. It's also something that integrative physicians use. For example, acupuncture, some supplements, some botanicals. However, the difference is that in a functional approach, the integrative therapies are used to address the root cause and not simply alleviate the symptoms as is done in integrative medicine. So I think that, and I think last but not least, another factor which also is different between integrative medicine and functional medicine is that in functional medicine, the patient is the lead. And in conventional and integrative medicine, the physician is the lead. And what I mean by that is that when a patient comes to me and I'm presenting the options, I'm not telling the patient, you should do this, you should do that. I'm going to say, here are the 3 options. Here are your exposures. What would you like to do? Because it's a real partnership. It's not like I'm the physician, I'm going to tell you what you're going to do. Here's what you're going to do. Because that model of medicine where the physician becomes the lead is based on the assumption that the physician knows more and the patient knows less, and the patient is incapable of making an informed decision. And that is not necessarily the truth, because most people, most people can make an informed decision. They have the brain. The only thing we have to do is to explain to them the options, the pros and the cons, And then they, looking at their own situation, which they can assess much better than us, can actually come up with something that they feel comfortable doing. And I think that is the part about functional medicine that I love the most, because you are taking a backseat and you're saying, look, I'm here for you, and I'm going to do and I'm going to respect what you decide to go with, as long as you understand what's going to be the outcome.
And I love that. And that's something that I work with a number of my patients on, is this idea that, I might have the expertise in the science and the data, but they're the expert in their body, and kind of working together that way. And so one of your areas of expertise is autoimmune and immune health and disorders. And since this is a podcast that focuses on mental health, let's chat a little bit about kind of the relationship between autoimmune, immune disorders, and mental health. Can you talk to us a little bit about that?
Sure. So there are many, many, many common factors between autoimmune diseases and mental health. So what are the common factors which kind of affect both of them? Okay. So the first and most important factor, which is present in both scenarios, is inflammation. Mm-hmm. You cannot have an autoimmune disease without inflammation. And if you have mental health disorder, it's the inflammation of the brain, And so if there is going to be inflammation, it will manifest itself as autoimmunity, as mental health disorder. So that's the first connection between the two. Interestingly, we now know that patients who suffer from autoimmune diseases are at higher risk of mental health disorders, which is not surprising. No. We also know that people who have high degree of stress are also the people who will have a lot more autoimmune flare-ups. And I had a patient which was so interesting. Her start of RA, rheumatoid arthritis, was exactly when she was under extremely high stress because she was going through a divorce. And then divorce kind of finalized and everything settled down, it got better. And then she had another trauma, and literally you see another flare-up of RA, which was literally, you could see the swing going up and down as a result of the stress in her life. So that's number one. Number two, the other very interesting commonality between the two is microbiome. So the gut bacteria, we know that leaky gut or intestinal permeability is the first step towards development of autoimmune diseases. And we also know that when somebody has depression or anxiety, the first line of medication that we use is SSRI, which are serotonin reuptake inhibitors, right? Selective serotonin reuptake inhibitors. And we know the way the selective serotonin reuptake inhibitors work is by increasing serotonin at the junction where the neurons or nerve cells communicate. However, having said that, most people do not know that 90% of serotonin is produced in the gut. We also know that other chemical messengers used in the brain, such as GABA, is also produced in the gut. Dopamine is also produced in the gut. And so basically the gut is where the gut bacteria are that are playing a very important role in the production of these neurotransmitters or chemical messengers used in the brain. So if the gut is not going to function, or the gut bacteria are going to be inadequate or pathological in nature, then you will see both autoimmune diseases and you will see mental health disorder. So if the gut gets better, both of those diseases are going to invariably get better. The third connection between the two is nutritional deficiencies. We know very well, for example, vitamin D is critically important for immune function and immune regulation. And vitamin D deficiency has been associated with an increased risk of autoimmune diseases, right? Similarly, nutritional deficiencies have also been implicated in mental health disorder. For example, vitamin D is called the happy vitamin. So if you don't have it, you're not going to be happy, right? And so nutritional deficiencies are also seen in both of these conditions. And that's the other common ground, where we see that. So all in all, when as a functional physician, when we look at somebody with autoimmune diseases, and mental health, we already know that there are a lot of common factors that are at work which could be contributing to both. And if we see somebody with mental health, we are already questioning, could this person actually have an autoimmune condition as well? And if they have a leaky gut, you can definitely do an autoimmune panel, and you should not be surprised if they have a positive ANA.
Yes, yes.
One other thing which is very interesting, and that's the sad part about the system, is that most autoimmune diseases develop over a course of 10 to 15 years. What that means is that their symptoms may start and they would fluctuate, and they will move from one organ to the other. They'll say, I'll have pain here, but then it got better, but then I had pain in the feet and that got better, but now I'm actually fatigued. And the antibodies will also fluctuate. So you'll have positive ANA, but it will become negative. You'll have some antibodies, but they will go negative. And in this process, the system can actually create a lot of stress for the patient, because when they go to the physician, by the time they go, the reason for their visit has already changed.
Yeah.
And a lot of times their blood work is completely negative. So basically, they do not have what we call a diagnostic code, right? And so they're often frustrated because they will say, I have fatigue and I have brain fog, but their primary care physician or the rheumatologist will say, but you don't have a problem. And that often leads to literally what I would call micro trauma, because if they go from one doctor to the other doctor to the third doctor, they're literally like this football being moved from one specialist to the other. And everybody is telling them that they have something wrong with them, which is basically that they are crazy. And so even before they would have a mental health manifestation of autoimmunity, they already feel depressed because the system is not able to help them figure out what's going on. And we see a lot of what I would say undiagnosed autoimmune conditions that are brewing, but have not necessarily completely manifested. And the idea is that earlier you start, the better it is. But in conventional medicine, the idea is that you have to wait till the complete manifestation is there. And I do understand the reasoning for the conventional system, because the medications that are often used have such strong side effects that you want to make sure you have a reason to use them. But unfortunately, in the process of you trying to save the patient suffers for a very long time before something is done.
Yes, and I've definitely worked with a lot of patients who describe almost a sense of relief with the diagnosis, even though it's not a diagnosis that's positive or it's a diagnosis that something is wrong, but it comes with a sense of relief because at least now we have a diagnosis.
And I think it's a false sense of relief because I have patients say, but doctor, can I say that I have this disease? And you have to say that, even let's suppose we diagnose somebody as rheumatoid arthritis or lupus because they have certain antibodies, the diagnostic system that we have developed does not tell us anything in terms of what's causing the problem. If the antibody is A, it will be directed towards this organ. If it's B, it will be directed towards that organ. But so what? And if you have one autoimmune disease, you have a 30% chance of developing another autoimmune disease, which means another antibody against some other organ. So, I think that, again, I think the reason why the patient feels relieved is somebody is believing them ultimately,
yes.
because nobody was believing them, and they want somehow everybody to believe that they have a problem. But unfortunately, the diagnostics or the criteria that we use for diagnosis is pretty worthless when it comes to reversing these conditions.
Mm-hmm. And with all of these things, it does also seem like a number of these things are actually increasing in recent years with added stress and inflammation and changes in our diets and nutritional depletion in the food around us and all of those kinds of things. And one of the things that about autoimmune diseases is that they do tend to impact women disproportionately. Why do you think that is?
You're absolutely right that, we know that women are 9 times more likely than men to develop autoimmune diseases, and are several factors which contribute to that. One of the most important factors is hormones, because we know that estrogen can enhance immune responses while progesterone has immunosuppressive effects. So we have to understand that during a lifetime, women actually experience fluctuations of these hormones, right? Particularly if you talk about pregnancy, we know that a lot of these autoimmune diseases flare up during pregnancy. And the reason is because the hormonal balance or hormonal milieu is such that it actually helps the fetus and helps the pregnancy, but it does affect the immune system in a way where the immune system can get stimulated, and that's why you see a lot of these pregnant women either around the time of their treatment or around the time when they're trying to be pregnant or while they're pregnant or just at the end of the pregnancy would develop thyroid issues. And so that is one of the most important reasons why women are predisposed more than men. The other reason is that some immune disorders are associated with specific genes located on the X chromosome. And we know that women have 2 X chromosomes as opposed to men that are 1 X chromosome. So obviously, we have a higher likelihood of being predisposed to autoimmune disorders. The third and very important reason, and I think you mentioned something very interesting. You mentioned how there has been an increase in autoimmune diseases. And not only has there been an increase in the prevalence, we are detecting more and more different kinds of autoimmune conditions in the last 30 years or so. Now, we have to understand that for genes to change, like, how a lot of times we blame our parents or grandparents, oh, we have genetic risk and this and that. But for genes to actually change, genetic material to change, it takes hundreds of years, right? It's not going to take 30 years for genes to change. It means that it's not that somehow, we didn't have the problem and suddenly we have the genes and now that's what's happening. What is happening is that we have always had those genes, but the genes are now being triggered, and what is it that's triggering that gene? And that's where I would look at environmental factors. So environmental toxins are also known as xenoestrogens at times. Xeno means foreign, and they are called foreign because they actually are generated outside the body. But when they get inside the body, they act exactly like estrogen. So for example, we have pesticides, we have plastics, we have personal care products, we have medications, So when they enter the system, they act as xenoestrogens, they act as estrogens. Now, women already have estrogen, and then you are exposed to xenoestrogens. By the way, mold toxins are also estrogenic in nature. And so imagine the load of estrogen in your system. So of course, you are going to be at a higher risk than men and that is also the reason why if you look at in men, the exposure of xenoestrogen has been implicated in the reduction in the sperm count. As you know, that the sperm count has reduced to the extent that we have changed the references for that, which is like crazy. Like, why would you change the references? You should say more people are having the problems of changing the reference. I think you think differently, at least I don't know why, but that's not what I would have done. So I think that we are seeing a lot of infertility in men, sperm count, sperm motility, and all of that is linked to exposure to these xenoestrogens. Rather, there was a study done where they were surprised that they found that the male frogs actually had changes, more feminine changes in their way they croaked and stuff like that. And they felt that was because of what these frogs were exposed to in the water. And so I think what we are seeing here is these xenoestrogens in the environment, which are also predisposing us, women, of course, and men in different ways, to kind of be susceptible to these autoimmune conditions.
So we've got a lot of environmental factors. We've got kind of these epigenetics, the turning on and off of various genes, and this is impacting autoimmune conditions and mental health. And so what are some tools that patients can try to implement to try to maybe reduce their risk of having autoimmune conditions, mental health issues, these kinds of symptoms, or at least decrease their severity? Because you've alluded to, environmental kind of interventions, lifestyle interventions. You're a mindfulness coach. I imagine it's all of the above, but tell us a little bit more.
So I think, there are exposures that you can control and the exposures you cannot control, right? So I'll talk about exposures that we can control, because there'll always be exposures. For example, we had these wildfires, in Canada. I mean, who can control that? Nobody can control that. But what we can control, there are few things that we can all have control, and they will affect both autoimmunity and they will affect mental health. One of the most important is what we consume. So when we talk about the SAD diet, standard American diet,
which is such a perfect acronym for it.
Yeah, it is a sad diet. It does make you very sad. And sad from multiple perspectives, mentally sad, physically sad. So basically, that, is the key problem that we are witnessing. And now we have this market, that's figured out that people are beginning to get it. So now we have a new marketing gimmick. And that gimmick is organic. I'm a big believer in organic stuff, but you have to be careful when the organic comes on a processed food label. Organic Cheerios. Really? So I think that, anything that you process and anything that you cannot produce at home, I don't care if it's called organic or pure or natural or whatever you want to call it, it's crap. It's very simple. If God has made it, it's in your best interest. If man has made it, it's definitely not in your interest. And so I think getting on a diet where you are consuming what nature has produced, organic fruits, organic vegetables, clean food, I think that is the most important thing to focus on. That is basically eating anti-inflammatory, eating no chemicals, not consuming anything which would cause inflammation. Because like we talked about inflammation as the basis of everything, right? And so that is the first and foremost thing. And here, the one thing I would say, and I'm very frustrated with that, I can't do anything about it, is the amount of sugar, we have, in our diets. Mm-hmm. And the one thing I would say is that if I could, I would basically put a ban on sugar, if I could. And I'm talking about sugar per se and sweeteners, sugar and sugar substitutes. And there's so much data on how these sweeteners are causing harm that, most people who we are marketing these sweeteners towards the diabetic industry, the diabetic patients, not realizing that we are predisposing them to other health problems. So that is where I would say that if you're going to avoid sugar and you're going to avoid inflammatory foods, you will protect yourself. That's number one. Number two, I think that one of the things I've realized, they say better be late than never, after my burnout, was that stress. The pace of our lives is not the pace we were genetically supposed to have, And
that's so, really powerful. Let's just pause and underline what you just said.
Yes, absolutely.
The pace of our lives is not what we were supposed to be living.
Exactly. And so I think that, and part of the problem is the mindset that we have created in the society, that if you're not doing anything, there's something wrong with you. If you're not running like everybody else, you are definitely crazy or you are lazy. And none of that is true, because I think that it's so important to have times during the day where you say, you know what, that's it. I'm done for the day. 2 hours, my hours, not doing anything. I'm just going to sit. I'm just going to relax. I'm just going to do something that I love to do. And this idea of disconnecting is extremely important. Disconnecting from devices, disconnecting from work, and actually connecting with self. What is inside you is very powerful. And if we're able to disconnect ourselves, if we are able to look within ourselves, that is very powerful, because it is the way you allow the system to recover.
Yes.
you know. And so I think that I would call it as a stress management strategy, to be able to not allow the pace to cause problems. Because we know that when we are under a tremendous degree of stress, then we release a hormone called cortisol. And cortisol can cause mental health issues and definitely can cause autoimmune conditions. So it's very important to disconnect. The third thing I think that I have seen to be a huge problem, particularly in our culture, is that sleep hygiene is non-existent. People are sleeping at 12, they're sleeping at 1, they're getting whenever, whatever, however, sometimes not even good quality of sleep. And it's just not that the hygiene is not limited to sleep. Their life has no hygiene. I mean, you consume lunch, dinner, whenever, like there is no time. I mean, you are just grabbing something, running. And so, I think if you look at animals, we can learn so much from animals. We all love animals, but we don't really pay attention to them. They have their routine. They will eat at their time. They will sleep at their time. The world can go on one side. They will go on the other side. They don't care about what the owner is doing. They'll do what they need to do. I think we have to learn that, in nature, everything happens at a particular time. The sun does not decide to come out in the evening, and the moon doesn't say, I'm going to come middle of the day, because everything has a time, everything is organized, And so I think that, we need to have our life have a routine, a time to sleep, a time to wake up, a time to eat. And the more our lives are organized, the more we actually make a schedule and follow a schedule, you will see the system actually will start to get better. Because when you have the meal at the same time, your body already starts preparing for it. When you sleep at a particular time, the melatonin, which is the hormone of sleep, starts to get released because your body knows the pattern. It knows where it's going. But if you do everything very abruptly, you do not even give the system a chance to get ready and do what it needs to do. I think that we need to have a life. We're not living, we're just surviving. We have to get into the living mode by having consistency in how we live our lives. I think that is very, very, very important. And then last but not least, I think that we need to be mindful of environmental factors. I think that never before in the history of man has man consumed the amount of chemicals that we use on a day-to-day basis, from shampoo, conditioner, toothpaste, deodorant, like the list keeps on going, a cleaner for the clothes and a cleaner for washing. Like it's just the amount of chemicals that we are exposing ourselves to is tremendous, and we have no data. Unfortunately, a company that makes these chemicals and brings them out does not necessarily have to do long-term research. And even if they are able to, let's suppose if you're able to do a research on X chemical, okay? And you say, well, this chemical in a quantity of 1 milligram is safe. And there is another chemical that comes in the picture, which is also safe at 1 milligram. We still do not have the research that if the two chemicals, 1 + 1 milligram meet, what is going to happen? Mm-hmm. And a lot of times, 1 + 1 is not 2. It's 222 at times. And that is where the problem comes, that you may say, but well, this is very little. It's just a little tiny bit, it's not much. But tiny bits all over, all the time, what are you going to get? Mm-hmm. And so I think it's very important that, and I think there is an industry which makes women and men feel that they're inadequate without some of these chemicals. For example, I have seen a lot of women in my practice, they have to do their nails and they have to have lipstick on. They actually feel inadequate because somehow the culture makes them feel that, no, this is not acceptable.
Yeah.
And I think that we have to be able to, we need a force which tells these women that no, you are beautiful. And this is not something that you have to put on yourself to be able to see yourself as beautiful. And I think that is a lot to do with conditioning. You know, as I've said before, that we see little girls going with their moms, to get nail polish and, to do those little things. And I think we are creating these habits, and we're creating emotional attachments with these habits. Imagine a mom taking her daughter to a garden saying, today we're going to play badminton. This is going to be our treat. Instead of saying, today we're going to go to a nail salon and we're going to get some nail polish done, So what are we really doing with our kids? What kind of role models? And I think this is concerning because for the first time in the history of United States, we are seeing that the mortality is actually, the age at which we are dying. Instead of it going up, it's going down.
Mm-hmm. Mm-hmm.
And so basically, what are we leaving for our kids? Shorter lifespans.
Yeah.
Not a good idea.
Yeah.
And so I think that would be another thing that I would say that we need to really think about.
Yeah. So thinking about our nutrition, thinking about stress management, thinking about sleep hygiene, structure, and exposure to environmental toxins.
Absolutely.
Thank you. Well, so if someone is struggling and maybe they are considering seeing a functional medicine doctor, how would they find one? How do they know who to see?
So I think that there is a place called Institute of Functional Medicine. This is an international institute. You can put your zip code in, and you will be able to list of functional physicians in your area. That's the easiest way to do it. It's a place where you will not only find who the physicians are, but you'll also find their credentials. And I would stress that credentials are important. And I would definitely say, please go with the physician for sure.
Yes.
Because I think that the training, the training that a physician has for functional medicine, it is very important that you have to know the conventional medicine really well. You can't just go and say, I'm going to do functional medicine, even though I don't know anything about conventional medicine, right? Functional medicine is built on conventional medicine. It doesn't stand alone. This is very important to know. So make sure that you're going to a physician. The second thing I would say is that a lot of physicians provide 15 minutes of complimentary consultation. And I would ask you to avail that. And I want you to be able to read some books before you actually make the call, because you want to make sure that the physician actually has expertise in that area. Because autoimmune diseases is not as easy as looking at gut issues. Autoimmune diseases look at a spectrum of things in addition to the gut. Like you have to know Lyme, and you have to know mold, and you have to know environmental toxins. And everybody is not an expert. We see a lot of patients from other functional physicians that come, and one of the biggest problem is that they are not experienced in it. So they started somewhere, but they couldn't finish it. And so I think it's important that you talk to them. And because if you would have read the books, you would know exactly what you want to talk about, and then you will be able to make an informed decision of who you want your physician to be, because it's a very, difficult journey. I wouldn't say it's an easy journey. It's a difficult journey. It's a difficult journey because there's a lot of change involved. It's not like taking a pill. Anybody can take a pill, but not everybody can change their diet and their lifestyle and the way they eat and the way they sleep and how they live their lives. So it's a difficult journey. It's a very rewarding journey. Everything that is difficult is valuable. We become physicians, a very difficult journey, but it's very rewarding. So it's a difficult journey. I wouldn't say it's an easy journey, but I would say that it's a very rewarding journey for yourself and your family, because when one person in the family gets better, the whole family gets better, because everybody comes together to support that person. So their diet changes, the way they live changes. So I think it's a very rewarding journey, but it's a commitment.
Yes.
So you have to know what you're doing.
And so how would patients potentially be able to find you and resources that you recommend? And we can certainly include all of the links in our show notes.
Sure. So one of the things I would say is that one of the activities that we do as a practice, to empower the community, because I think at the end of the day, a physician is responsible for contributing to the society. And one of the things we do is every week, we actually put out this newsletter. And if you go to www.theholistichealing.org, you will be able to subscribe to the newsletter. And every week we send you, what can you do to help yourself? What can you do to prevent chronic diseases, including autoimmunity? That's one thing you can do. It's free of cost. And it's something that will help you. The second thing is we do offer a 15-minute free complimentary consultation where we talk to you about what we can offer. And one of the things that I think is very important for me is transparency. So we're very transparent about what is it that we can do, what is it we cannot do, because this is not magic, this is a practice. And so we talk about the journey. And so that you can avail. And so that's the second thing that you can do if you are trying to look for me. And then once we do 15 minutes, you actually understand what's going on. Then we go on to get you on an initial consultation, because we don't want to start with initial consultation. So once you have had the 15-minute consultation, then we want you to go ahead and get the 60 minutes of initial consultation, because we want to make sure that we're on the same page in terms of expectations before we start the journey of functional medicine. So that is how you can actually connect with us and communicate with us.
Wonderful. Well, thank you so much for being on the podcast today. Any final words of wisdom or pearls for our listeners?
Yes, I think that, one of the notions that we have in conventional medicine is that autoimmune diseases cannot be reversed. That is absolutely not true. Autoimmune diseases can be reversed. And I would ask you to look into a webinar I did, Freedom from Autoimmunity. It's a free webinar on our YouTube, and you can get to that button through the website, theholistichealing.org, where we will see a patient actually talking about her journey of reversing rheumatoid arthritis. And she's not the only patient who's done it. And I'm grateful that I have these wonderful patients who actually put in a lot of work to reverse the autoimmune diseases. So you have to know that you can do what you want, provided you are committed, you are consistent, and you're persistent. So do not let anybody tell you that you can't do this, that, or the other, because human potential to heal is immense. It's about, can you unleash it? Can you help the body achieve what it's already trying to achieve? So I think that the body's wisdom of symptoms is basically a call for help. And if you help it, you will be able to achieve what you want to achieve.
I love that. Perfect. Thank you so much.
You're most welcome.